abnormal. Dia rupa bentuk dia, there are sifat-sifat dia yang actually showing that they are abnormal cells and they are prone to apa? To transform or to become acute leukemia. That's why I letak dia dekat sini. Dia actually kotak dia dekat sini tau. Sebab tu dia colour dia biru. Bukan yang purple ni, colour dia biru. Cuma sebab dia dah sempit kat situ. Okay, so they can become acute myeloid leukemia. But tu I letak dekat situ. Okay, right, but we won't discuss this today. Right, so there are 3 broad categories. AML. Okay, this one, okay, I dah mention that one. Okay, so your myeloid neoplasm is more heterogeneous. Okay, it's more heterogeneous, but it still originate from hematopoietic progenitors. Okay, hematopoietic progenitors or those stem cells that I showed you earlier. Okay, so this is what your blast looks like in acute myeloid leukemia. Serupa ke lain dengan yang acute lymphoblastic leukemia tadi? Lain sikit lah. Okay, so there are some that memang kita tak boleh differentiate. Memang dia nampak sama. Okay, dia nampak macam lymphoid. Lymphoid ni usually dia memang lymphoid lah. Okay, dia memang nampak smooth, baby, high NC ratio, scan cytoplasm. Okay, so this is what your blast in AML would look like. Some of the subclasses would look like. So this is what we call myeloblast. You tak ingat perkataan myeloblast ni, suffice for you to know AML is the neoplastic cells are made out of about blast cells. Blasts. Right, so these are your blasts. Big nucleus, yes, large nucleus. Cytoplasm, sikit, banyak, a bit more. A bit more. Okay, so nanti compare dengan yang the first type of blast tadi. Okay, compare the cytoplasm, right? So some of them may have granules, some may not. Okay, and they have apa? Nucleoli. Nampak the brain of the nucleus. Ini apa? Conspicuous ataupun apparent nucleus, nucleoli or nucleolus. Okay, boleh ada satu, boleh ada multiple. Nak jadi hematologist? Tak tahu lagi ya. Okay. So another feature, okay, to distinguish them under the microscope is the presence of auroids. Cuma you don't need ni our A-U-E-R sebut dia auroids. Not auroids, not auroids. The our tu pun janganlah our kan. Okay, so auroids. So you have, these are actually granules. Okay, granules that kind of like stick together and they become like dia nampak macam crystal, crystal dekat situ. Okay, auroids. Okay, but not necessarily you will see in all types of AML. Just another feature. Okay, right. So it can occur at any age. Okay, ni macam ni lah, anytime. Okay, so bila macam ni maksud dia apa? Genetically dia apa? Somatic. Ni dia somatic. Tiba-tiba je. Okay, switch on. Right? So there is arrest in myeloid development. Okay, sama juga. Kan? Maksudnya apa? You don't get to your final product. Okay, dia terbantut somewhere up there in the development. Okay, and complications are the same related to anemia, thrombocytopenia, neutropenia that I mentioned just now. Okay, so just on its face, you would not be able to tell whether a patient has acute myeloid leukemia or acute lymphoblastic leukemia. Okay, but you have to make that distinction because treatment depends on the type of lineage that you are facing. Okay, so AML is very heterogeneous and WHO classification bawah all this ada macam-macam, ada 8-10 jenis. Okay, but enough for you to know kind of like, okay, so there are some four main categories here. Right? Okay, so let's look at some molecular aberrations. Ingat lagi, acquired causes, acquired causes or the pathogenesis of this leukemia, okay, is genetics. Okay, so one of them is this. So some genetic aberrations here disrupt genes encoding transcription factors that are required for normal myeloid differentiation. Okay, so these are the common ones. I tak sebut yang tak common. Okay, translocation 821. Okay, so this translocation in the chromosome disrupts this gene, CBF1 alpha gene. Okay, and then you have another one, inversion 16. Okay, inversion 16. Your 16 you terbalik, chromosome 16 you terbalik. Okay, so this disrupts CBF1 beta gene. Okay, so a patient may have this or may have this, okay, chromosomal abnormality. Okay, and these genes are important to produce transcription factors that are required for normal hematopoiesis. Okay, so just trying to show you the link, what happens when a patient develops an acute myeloid leukemia. Why it becomes an acute myeloid leukemia? Why there is abnormal or halted differentiation? One of the reasons is this. Okay. Next, another form of acute myeloid leukemia, which is very important, is acute promyelocytic leukemia. Ataupun dalam buku, they put that as AML-M3. Okay, so this is historical lah. AML-M3 tu nama dia yang dah lama, so they keep it. Right? So this comes with very prominent morphology. Kalau I nak tanya waktu exam, I tanya ya. Kalau I nak tanya lah, kalau. Okay, because it has prominent features for you to understand. Okay, or for you to remember. Okay, so APML, we diagnose APML in hospital Ampang, we have to look for this abnormal promyelocytes. Okay, so they are not blasts per se, but the abnormal cells are in this type of leukemia are in this type of AML, acute myeloid leukemia, are abnormal promyelocytes. These are abnormal, these are abnormal, these are abnormal. Abnormal promyelocytes. Are you supposed to see promyelocytes in the peripheral blood? Yes or no? No. Okay. You patut nampak apa? Neutrophils. End of story. Okay. The moment you see promyelocytes hanging around in the blood, okay, there's something wrong. Okay, so you have to exclude whether this is APML. Alright. So one of the morphological features of this leukemia is presence of what we call faggot cells. Okay, nama ni bukan I yang pilih, memang dah ada ya. Faggot cells. Okay, so these are abnormal promyelocytes with stacks of aurods. Ingat tadi aurod tadi yang macam crystallized granule tadi kan? So just stacking macam ni. Lebih kurang lah yang ni pun macam stacking juga ni. Some may argue, but for undergraduate it's fine. Okay, stacking. Okay, so these are faggot cells. You only see this in APML. Okay, so going back, why? How does APML occur? Again, going back to genetics, acquisition of a chromosomal translocation. In this case, it is translocation 15-17. Listen, tak nak buat soalan. Because it's so specific. Kan? You would be not that smart to skip this during your revision. Okay? For either professional or for your coming semester exam. Okay? Right, so this creates a PML-RARA fusion gene. Chromosome translocation 15-17. Gene is PML, RARA. Do not mix up the two. Okay? So what happens is that this fusion protein interacts with transcription repressors. Transcription repressor ni sepatutnya apa? Buat apa? It inhibits granulocytic maturation. So repressors memang inhibit granulocytic maturation, and this fusion protein makes it even worse. So that's why your cells become apa? Dia stuck dekat apa? Promyelocyte. Dia tak boleh move on. Okay, it cannot differentiate further. Okay. Right. So what happens is that kita boleh bagi ubat. This is one of the acute leukemias that has a magic bullet. No other solid organ, tumor, breast, whatever has a magic bullet. This one does have a magic bullet. That's why clinical hematologists are apa? Kat luar sana are considered apa? Separa Tuhan. Demigods. Because you can apa? Cure. Okay, kita taklah, kita orang Islam, kita tak percaya benda tu. Okay, tetapi tengoklah dekat sana clinical hematologist rata-rata apa? Non-Muslim. Non-Muslim boleh kira dengan jaga. Okay, because you are considered demigods, you cure cancer. Okay, so the ubat will reverse this. It's either they reverse, they can allow differentiation to occur, ataupun dua-dua lah, sama lah. Dia akan elicit the differentiation. Dia akan allow the leukemic cells to differentiate. Okay, the unblock. Bila dia block differentiation, dia unblock. Okay. So for AML, sama je. Alright, what you would expect to see in any acute leukemias. But for APML, it is commonly seen in young females, and bleeding. Bleeding is an important complication. Okay, you do not want to wait for patients to bleed, because when they bleed, it's not just bleeding, they develop what we call disseminated intravascular coagulopathy, which we will go through next week. Okay, right, so one more. Okay, so the last one we are going to dive into is your chronic myeloid leukemia. Okay, chronic myeloid leukemia. So again, all these diagrams on genetics. If it scares you, let it scare you now. Biar takut sekarang. Bila takut, baca. Attack benda tu. Cuba faham. Alright? Okay, so these are all acquired chromosomal translocation, acquired abnormalities. Here, the chromosomal translocation is apa? Translocation 922, ataupun nama dia is Philadelphia chromosome. The first genetic aberration that was found to be linked to a cancer. 1976. That's why we dapat nama sendiri Philadelphia chromosome. Okay, the fusion gene that develops is your BCR-ABL nama dia. BCR-ABL is the gene. The chromosome is Philadelphia chromosome, or translocation 922. Okay, so this gene directs the synthesis of active BCR-ABL tyrosine kinase. Okay, so tyrosine kinase is a enzyme, is a growth factor enzyme which becomes constitutively active. Maksudnya dia apa? It doesn't shut down 24/7. It is operational. It is activated. Okay, so this activates growth factor independent proliferation. Dia tak perlu arahan siapa-siapa. Dia apa? Buat. Okay, it stimulates, promotes survival of bone marrow progenitors, but with normal differentiation. Okay, so you akan dapat banyak. Warehouse you apa? Penuh dengan all the end product. Okay, tapi nak guna sama aja. permintaan sama je, but you have what? The whole kilang is all full of this. So that's why it's called a myeloproliferative disorder. Okay? Right. So primarily a disease of adults. We do see in children, but very rare. Again, do not diagnose CML in children when we give you a question. Okay, CML is a primary disease of adults. Usually we can see already when they are 30 and when they are 60. Okay, so that's what it means by a bimodal onset. Okay, so if you see the signs and symptoms, almost the same. Okay, but these are mainly due to hypermetabolism, due to increased cell turnover. Okay. So laboratory findings, you would expect to see high white cell count, leukocytosis, thrombocytosis, and because of the high cell turnover, you see an increase in lactate dehydrogenase, LDH. Okay. So CLL, the morphology. Okay, so this is probably you wouldn't be able to see much lah, here, but suffice to say that there are different phases in CML. Also, there's a magic bullet for CML. Penyakit ni treatable, controllable, like hypertension and diabetes mellitus. Okay, prognosis is fairly good as long as you keep it in the chronic phase. Once it goes to accelerated or blast crisis, you start, there can be a transformation to acute leukemia. Kalau dia nak develop acute leukemia, what type of acute leukemia? Acute? 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 Myeloid leukemia. Tengoklah line dia kan. Line dia dekat situ kan. Right. So this is some of the terms that you would need to familiarize yourself. Leukemoid versus leukemia. Okay, so mana yang oid tu humanoid, android. So it means apa? Seakan-akan, likeness. Okay, a likeness, looks like leukemia, but it's not. So this describes an elevated white cell count. They can have NRBC, they can have all your granulocytic precursors like I mentioned. Your precursors semua duduk dekat mana? Bone marrow. Kan? Bawah tu final product sahaja. But in some instances, you may see this in extreme physiological response, pregnancy, you can get stress, infection. So usually if we see this, we ask to monitor. Repeat the sampling in a few weeks. Let's see if there is a trend. Okay, but in the lab, if we see quite a number, but we are still not sure, we can do a neutrophil alkaline phosphatase test. Okay, so a NAP score. So this NAP score will be high if it's reactive. Sebab dia normally functioning kan. So the granules will be normal, they will pick up the dye and they will give a high score. Okay. Right, habis. Right, so ada yang baru masuk tadi. Okay, balik cuba baca notes and try to do. If you can answer this, if you can do this, then hematology, at least for leukemias, are covered. You are able to cover. Okay, so when you are discussing the different types of leukemias, make sure you know what the origin of the cell is. Okay, what is the abnormal cell or the neoplastic cell? Okay, is there a genetic aberration or mutation associated with it? Okay, and how does this molecular change cause the leukemia? Kan APML lain sikit, CML lain sikit, betul tak? Okay, and what are the main morphological features that you would expect to see? You can do this, halas, habis. You have studied leukemia, boleh bawa sampai final year. Okay, alright, thank you.